All right, today we're going to dive into something really fascinating, an incredibly precise medical technique called brachytherapy. It's a powerful way to take the fight against cancer right to the source, from the inside out. So let me start by asking you a question. How do you fight a battle from the inside out? In the world of medicine, thinking about this very question has led to some truly amazing breakthroughs. And to really get why an internal approach is such a game changer, we first have to understand the fundamental challenge of treating cancer. It has always been an incredibly delicate balancing act. This right here lays out the central puzzle perfectly. The goal? Well, that's always been crystal clear. Destroy the cancer cells. But the huge challenge has always been, how do you do that without damaging all the healthy tissue and organs right next to them? It's a problem that demands just surgical precision, but on a microscopic level. And this is exactly where brachytherapy comes in with a totally brilliant solution. It completely reframes the problem by changing the point of attack, moving the fight from the outside to the inside. So what is it exactly? Well, brachytherapy is a type of internal radiation, and the name itself gives us a huge clue. It comes from the Greek word brachy, which means short distance, and that is the whole idea behind it, delivering treatment over a very, very short distance. Here's the perfect way to picture the difference. Think about traditional radiation like trying to light up one specific room in a house by shining a giant spotlight on it from across the street. Yeah, you'll light up the room, but you're also blasting the walls, the windows, the neighbor's yard. Brachytherapy, on the other hand, is like walking right into that specific room and lighting a small, bright lantern. All the energy is exactly where you need it, with almost zero spillover. So, you're probably wondering, how do they actually do this? And while it sounds really complex, it's actually a highly controlled and meticulously planned procedure. Let's just walk through the steps. It's incredibly systematic. First, doctors use advanced imaging like CT scans or MRIs to create this super detailed 3D map of the tumor. Then, using that map as a guide, they place tiny radioactive sources, we're talking sometimes as small as a grain of rice, right inside or next to it. These little sources then do their job, emitting radiation that damages the cancer cell's DNA. And finally, depending on the treatment plan, those sources are either taken out after a little while, or they're permanent seeds that are just left to decay naturally and harmlessly over time. Now, brachytherapy isn't a one-size-fits-all thing. It's much more like a versatile toolkit with different approaches that can be adapted for all sorts of cancers. You've got two main flavors. There's high-dose rate, or HDR. Think of this like a quick, powerful burst. A strong source is placed for just a few minutes and then it's removed. Then you have low-dose rate, or LDR, which is more of a slow and steady approach. Here, tiny radioactive seeds are implanted permanently, and they release their energy gradually over several weeks or months. And this versatility is what allows it to be used for such a wide range of cancers. For prostate cancer, for example, you might see either LDR seeds or HDR. For others, like breast or cervical cancer, that temporary high-dose rate method is often the go-to choice. It's all about tailoring the treatment to the exact location and type of tumor. Okay, so let's circle back to the main idea here and talk about why this whole closer is better philosophy is just so effective. It all comes down to the precision advantage. First off, the radiation dose is incredibly focused. By putting the source right up against the tumor, you're making sure that the maximum amount of that cancer-fighting energy is concentrated exactly where it needs to be. It's not getting diluted over a huge area. And the crucial flip side of that is this. Because the radiation doesn't have to travel far, it spares the surrounding healthy tissues. It's all because of a simple rule in physics. The power of radiation drops off dramatically with distance. We're talking just a few millimeters of separation can reduce the dose to healthy organs by a massive amount. And that's the secret to minimizing all that collateral damage. So, at the end of the day, what does all this high-tech precision actually mean for the patient? Well, it can mean fewer side effects, it can mean shorter treatment times overall, and it often means a much, much quicker return to normal life. It's a less disruptive, more targeted path to healing. This really sums up the entire philosophy behind it. The goal is maximum impact on the tumor with minimal impact on the patient. That right there is the very essence of modern precision medicine. And that leaves us with a really fascinating thought, doesn't it? Brachytherapy is just one example of a much bigger trend we're seeing in science. From nanotechnology to gene editing, it seems like the most powerful breakthroughs are happening on a smaller and smaller, more targeted scale. Which makes you wonder,
Is the future of medicine all about getting smaller to achieve even bigger results?